We are on the way to the Ankirihiri Health Center in urban Tomasina, Madagascar. We know the statistics, and we are hoping that, at least in this one location, we can help to change them. Tomasina has a population of more than 250,000 people, most of them desperately poor. We have a twofold goal for our project. First, to train doctors and midwives from the Ankirihiri Clinic and from nearby Tomasina Hospital in best practices in handling maternal and neonatal emergencies. Second, to give the Ankirihiri Clinic the equipment and medications necessary to apply that training. The Ankirihiri Clinic provides health care for 1/4 of Tomasina's population, more than 62,000 people. More than 150 babies are born in the Ankirihiri maternity wing every month. Our medical team includes Dr. Carol Egner, an obstetric specialist, Dr. Jennifer Young, an OB resident physician, and Teresa Golbeck, a high-risk maternity nurse. Isabel Cole, a marketing executive, provides crucial French translation. When our medical team arrives at the clinic, 3 women are in labor and almost ready to deliver. All 3 are having their babies in the same small delivery room. Then a 4th woman in labor arrives. The team finds out quickly what the daily routine at Ankirihiri's maternity ward is like.
Delivered 4 babies in about 45 minutes. It happened all very fast. We're just lucky there were midwives in training, but apparently it happens all the time that they deliver that many babies all at once. And they're basically 2 midwives, and when I said, how do you do it? They said, we act like Spider-Man. We're back and forth constantly to make it happen, so it's pretty amazing.
This was the most amazing afternoon I think I've had in my entire life. Just joyous, and everybody had healthy babies, and I can't believe the amount of work that they do here, and with so little that they have.
The current delivery room has few of the supplies needed to respond to postpartum emergency. We have partnered with the International Medical Equipment Collaborative to ship a 20-foot container of equipment and supplies to Ankirihiri Center. The Watson Foundation has donated 30 cartons of essential medications. Peace Corps volunteers and our U.S. teammates move the new equipment and supplies to the clinic. Meanwhile, the classroom training portion of this program has gotten underway.
Down, and that delivers the anterior shoulder.
In one class, Dr. Carol uses Mama Natalie, a birthing simulator designed by Laerdal Global. It enables her to demonstrate how to handle complex delivery scenarios. Using Mama Natalie, Carol proposes situations that arise when patients begin to hemorrhage, and she asks the midwives to react.
Oh, excellent. The needle has a flat area, just a little bit in from the end of the needle, and that's where you want to grasp.
The classroom also provides a forum for learning proper technique for suturing lacerations that can occur at the time of birth, leading to hemorrhage and infection. The midwives and doctors learn quickly that Dr. Carol appreciates both their skills and their efforts.
Okay? Excellent. And towards me.
Vers Dr. Carol.
There you go. Excellent.
The students listen attentively to lessons on how to repair episiotomies, and they apply those lessons diligently, using special episiotomy suturing
And so
pads.
this stops the bleeding much better. And here we have the
Neonatally is Laerdal Global's newborn simulator. She comes equipped with her own resuscitation unit. Neonatally enables the medical team to explain best practices in handling newborn crises and to ask the students how they would respond. While mornings are spent in the classroom, the afternoons are spent learning about the new equipment being installed at the Nkirihiri Center. The new ultrasound machine has generated the most excitement. Ultrasound imaging can identify many potential birth crises in advance of a delivery. Sylvanie, one of the midwives, is pregnant, and she becomes the first candidate for an ultrasound.
All right, we ready? Say une fille. Shall name the baby Carol or Jen. Here's your baby's heartbeat.
Le battement du cœur.
Amen. Let me get it better for you.
Dr. Carol and Dr. Jen oversee hours of training to make sure that the students can locate the placenta, find the position of the baby's head, and can establish the patient's due date. While one group practices the use of the ultrasound, another group is learning how to use a Doppler to listen for a baby's heartbeat.
Stay there. I'm going to put it in one spot.
Vous voyez comme elle lâche pas, vous pouvez le mettre dans un endroit et essayer vraiment de le retrouver.
You try. The delivery
The time has come to position the new equipment in the maternity wing at Nkirihiri. Dr. Carol recommends that the current delivery area be expanded. She suggests converting an adjacent unused space into an extension of the delivery room. During a momentary lull in deliveries, the transformation of the delivery room gets underway. New labor room beds are prepared, and are almost immediately put to use. Teresa works with the midwives to assemble emergency supplies on the shelves beneath the new baby warmer. A postpartum hemorrhage emergency cart is now at the ready.
If a woman has a hemorrhage, they'll just wheel the cart to her, and they'll have all the things they need. So they'll have all their IV supplies and a catheter to put into the patient, and then the next jar is the IVs, if they need any packing, the Curlex. We've also made a specific tray for cervical and severe vaginal lacerations if they're the cause of hemorrhage, and that's already sterilized. And then the bottom is the balloons if they need those. And then
Our team reviews the correct use of all new equipment. In addition, new equipment is tagged with instruction sheets in French so that the clinic staff has ready reminders for its use. Shelves are stocked with supplies and with medications donated by the Watson Foundation. And the delivery room is now a delivery suite.
IV fluids, cord clamps, and the pediatric ambu bags. So the first day we came to the clinic, we were greeted with 4 deliveries in 45 minutes. They were all done in that delivery room with 3 beds very close together. And so we talked to them about making 2 delivery rooms We now have 2 beds in here, 2 in here with more than adequate rooms for the mom. We have a baby warmer in both delivery rooms, which they did not have before. 2 full labor beds and all the supplies that they'll need, and they're just 1 doorway away.
During our 2 weeks at Ankirihiri Health Center, we have introduced new equipment and best practices. To ensure the long-term success of these changes, we have also introduced a new method for gathering data and tracking outcomes. And we have arranged for regular communication between Dr. Carroll and the staff at Ankirihiri. Our time in Madagascar is nearing an end, but the growing rapport between the doctors and midwives and our U.S. medical team is one of mutual admiration and respect. We promise to return next year, and the midwives propose a deal.
In 2012, you will speak French, you will speak English.
C'est la deal.
C'est marché conclu.
Outside the center, the doctors and midwives gather around Dr. Carroll to voice their joint assessment of the 2-week experience.
Of your patient. It's been an honor to be here with you.
It's time to go. We all believe that our shared efforts at Ankirihiri Health Center will indeed help save the lives of mothers and babies there, and there is immense satisfaction in that.